Welcome to Project Orbital Health. We have a unique value proposition as our big idea for an AI-first approach towards driving digital transformation in healthcare. But what is the biggest challenge in healthcare? When we go back to the Hippocratic Oath, the doctor's mission is to do good and to do no harm. And we see success in healthcare mission as people aging while maintaining a quality of life towards a value-based healthcare, and our clinical workers less overloaded with a more humane proximity towards a reduction of costs and harm. So why? What is the problem they were trying to tackle? Since 1950, lifespan has increased, but on the other hand, health span has decreased. We see a gap of almost 10 years in quality of life. When we take into consideration all-cause mortality, Ishikawa fishbone diagram outlines that the majority of the factors points towards weight gain, inactivity, diet, and loss of muscle density. The World Obesity Atlas outlines that by 2035, half of the population will be obese. And as we go through the AI findings on health, it's interesting to see that since 2019, there were more adult diapers being sold compared to infant diapers. And all this goes towards sarcopenia, where elderlies above 80 had strong muscle density, particularly towards three muscle groups: jaw, hand grip, and core. For instance, these elderlies who had a diet and exercise towards these particular muscle groups were experiencing a much better quality of life, but there was also an aspect of meetings and social interaction that played a vital role in these clinical findings. So, connecting to that, World Health Organization has outlined that the social determinants of health play a vital role in the clinical outcomes, so that we must take into consideration a holistic approach as real-world evidence in planning our care treatments. That also drives us towards digital determinants of health, how well connected our patients are, Maslow hierarchy of needs from a psychological standpoint, evolving to a more complex psychological needs as outlined by Manfred Max Neef. So, what is the goal? Amil's objective is to take into consideration all these data so that we can validate nudges and incentives and see how that impacts clinical outcomes. In this way, by looking at an overall picture of all this data, we're able to reduce health risks and high-cost interventions with evidence-based medicine and increase its competitiveness in the market by increasing its profits. So the idea is to have a framework of vertical integration between treatment and planning of wellness so that we're able to care from the beginning of the approach, where patients have awareness towards this challenges of obesity, all the way through prediction and health span, moving away from a red ocean intervention fee-for-service towards a value-based healthcare that plans prevention and follow-up. So how are we going to do this? Through a managed end-to-end health journey integrated with AI. And this comes Project Orbital Health. Obesity reversal, baseline, intelligent, targeted artificial intelligence. We want to drive an innovative approach so that we can reimagine the care journey, leveraging the latest technology by joining the patient through this program, where they will choose an anonymous alias and they will receive a fitness tracker tagged to this anonymous alias. And using GPT-4o by voice interactions, patient will share their entire social determinants of health, and all these assessments, they're usually not captured on the EMR. All this through an automated fashion using LLMs and generative AI. They will be also incentivized by nudges to do micro workouts, meet other people that are undergoing the same protocol so that they can do outdoor workouts. And throughout this process, they will receive counseling via this virtual agent so that they're able to share the anxiety anonymously and complete their general assessment. And by understanding this evolution, we're able to trigger telehealth visits if necessary, so that until this point, patients are only catered by artificial intelligence screening, reducing the cost and the burden of health workers. As we feed this whole data into the future care plans, we're able to receive data-driven insights so that we're able to fine-tune this trial, and through repetitive monthly interactions, we're able to identify what it is that's triggering this obesity factors in most patients. So in order to enable this digital transformation, we have to consider the technology foundations. Through healthcare interoperability, followed by HIPAA and healthcare standards, we'll have a fabric for healthcare, one lake big data repository where generative AI are able to compile and input these data. And through data integration and anonymization, we're able to intervene using patient monitoring and wearable technologies, all driven by confidential computing on cloud computing, so towards creating a time-to-insight health business intelligence that will be able to do a clinical decision support system towards a prescriptive value-based care. But before we talk about digital transformation, we have to consider the people transformation around digital culture. And this goes towards promoting, fostering aligned values so that we can reach this business goal as a united organization, and making sure that we effectively communicate safely this whole change management process throughout iterations so that we can move away from a silo organization to an integrated organization focused on the end goal, keeping in mind the most important, what's in for me, from all layers of interaction. This drives us into a change management framework where we engage a top-down role model approach from the senior leadership team, with their strategy being permeated as a cultural and values in the company, upskilling and maintaining talent retention through a governance committee towards human transformation, and creating this driving force of continuous involvement of all the layers of all stakeholders, making sure that we keep our priorities clear through an iterative approach, keeping our workflows monitored through this phase test so that we can assess the progress, maintaining our risk management KPIs monitored in order to be able to fail fast and learn lean towards a smart approach of iteration, and keeping our partner ecosystem engaged through accountability with a racing matrix. Talking about partnerships, we'll be engaging with several layers of stakeholders, as we have our EMRs that will feed the data captured from this interactive generative AI approach, our health vendors who provide the connectivity and interoperability, the cloud scalers, hyperscalers, the telemedicine and obesity boards who will support this initiative, as well as our federal regulators who will be able to accompany our approach towards anonymity and HIPAA compliance with handling the data, as well as patient advocacy groups to support this transformation from a human level and behavioral level, and keeping our research and academic institutions engaged as well, so that we can publish the results from this holistic approach using generative AI. And obviously, all these ecosystems of payers and value-based healthcare providers, so that we can share the lessons learned, failures, and success towards building healthcare analytics with experts that will drive patient engagements and feedback tools, so that we see how this is actually put into place. So the business plan will go through gathering the inputs, throughout comparing our competition through a SWOT analysis, defining the business and tech opportunities in this project, analyzing and prioritizing the options through the tech stack, as well as making sure that we have a clear deployment and implementation strategy outlined, with a political alliance to making sure that we engage our sponsors and stakeholders, so that with all these feedbacks, we're able to trim down an MVP and making sure that we have a trial that is well monitored in guardrails to be able to achieve ROI while mitigating the uncertainties that we will undergo, and being able to extrapolate all the metrics that will drive the success of the business goals of this project. So by consolidating governance, change management, and digital innovation, projects costs and extrapolated benefits on the long term will be able to sustainably and equitably care with an end-to-end holistic health for all Amil customers. So the vision is to make sure that we identify all these deviances that drive this obesity behavior from the care side as well as from the emotional and social side. And in this way, we're able to reduce the cost from keeping patients towards a lifespan and reduce risk from the portfolio management. And this will create a closer approach towards our quintuple aim, driving better operational efficiency and reducing Amil's debt. As we understand the AI advancements on this digital innovation era of information, we will have fitness coach, personal assistance, career and health counseling all through AI, but we must not forget human needs as we understand the companionship side of having connection with nature, friendship, family, and couple life. Thank you.